It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies. We also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies. Also for medically complex patients at home, including home TPN, home IV potassium infusions, home BIPAP, home CPAP, IV antibiotics, but also for adults and children that have a tracheostomy and are not ventilated. We also provide services at home for port management, central line management, PICC line management, as well as Hickman's line management. We also provide services for palliative care at home. In essence, we are a genuine alternative for a long-term stay in intensive care. Today, I want to answer a question from Angela who says, my fiance has been in ICU for a few weeks now and he wishes to go home, but he needs help with ventilation, tracheostomy, and dialysis. I have been doing dialysis at home prior to his hospital admission this time, but I don't think I can do both dialysis, ventilation, and tracheostomy. It just seems to be too much. Can intensive care at home help? And what would that look like? We are in Australia. Can you help? So here is what that would look like, Angela, so for your fiance. So obviously he's in ICU, he is depressed, he's had enough, he wants to go home for whatever reason, he can't be weaned off the ventilator. But, you know, the desire for him to go home seems to be very strong. And that's a good thing, you know. I mean, he's got the will to live and he's got the will to go home. So in Australia right now, you should be looking for NDIS funding. That's assuming, you know, there's nothing else. Your fiance hasn't had a car accident, or, you know, is a DBA client, or, you know, generally speaking, most of our clients are now funded through the NDIS, the National Disability Insurance Scheme. But even if your fiance would not qualify for the NDIS, you know, he might qualify for some hospital funding, for some Department of Health funding. These are all discussions we can have, you know, once you are certain that this is what you want to do next. I am certain that we can help you with this because that's bread and butter for us. I mean, you know, we have been operating in Australia since 2013, and most of our clients at home are ventilated, tracheostomy, you know, and if you need dialysis, or if your fiance needs dialysis, that's fine as well. We can do all of it. You know, we're basically sending you critical care nurses into the home 24 hours a day to manage all of that, you know, to keep your fiance at home predictably, and also make sure he has quality of life at home, because there is no quality of life for long-term patients in intensive care, no matter what anyone says. Also, you know, the cost of an ICU bed is around $5,000 to $6,000 per bed day, right? And intensive care at home is approximately half of that cost. So on top of, you know, improving your fiance's and your quality of life, the added on benefit is simply that, you know, there's some massive cost savings, probably around 50%, right? And again, this provides a win-win situation. Then, you know, once the funding is sorted, we will, you know, help you select a team, you know, the right team for you and your family, of course. You know, we help you select the clients, the staff at home that you that want to work with you and you want to work with them. You know, the right fit for your family, the right fit for your fiance, the right fit for you. You know, that's very important. We'll also take care of any equipment needs you might have. You know, if you need equipment, we'll take care of that. You know, we're also providing level 2 and level 3 NDI support coordination if you need help with that. And also, you know, our services are evidence-based. So what I mean by that, when you look on our website, intensivecareathome.com, and you go on the link mechanical home ventilation guidelines, you will see that on the mechanical home ventilation guidelines, only critical care nurses with a minimum of 2 years ICU, pediatric ICU or ED experience are safe to look after ventilated and tracheostomy clients at home. There's nothing else that is safe, right? And I would imagine the ICU would only let your fiance go home with a safe service like us anyway, right? We're also the only service in Australia in 2024 that has achieved third-party accreditation for intensive care at home, right? So it's all evidence-based, it's all accredited, and it's the best option for you, you know. And also you can have a look at our case studies, you know, how we keep clients at home. You know, we've done it many, many times. We've delivered probably close to 500,000 hours, you know, of intensive care at home in the last 10 years, you know. So that's a massive success for the space, massive success for our clients, of course, keeping them at home, you know. So I hope that helps you understand in how we can help you get your husband home. And if you have a loved one in intensive care in a similar situation, I encourage you to reach out to us as well. And we can help you take the same steps that we will do for Angela, taking your loved one home. Or if you're watching this as a patient yourself, you know, you can definitely reach out to us as well. Send us an email to support@intensivecareathome.com or to info@intensivecareathome.com, or simply call us on one of the numbers on the top of our website at intensivecareathome.com. Or you might be at home already and you have insufficient support and you realize that, you know, whatever support you have is not working for you and you want to change providers or you need more funding, then I encourage you to reach out to us as well. You know, if you need more funding, we wouldn't be in business if we couldn't help our clients with the right funding to make our service work, you know. And then with intensive care at home, like I mentioned at the beginning, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider. We are a TAC approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as a DVA approved service provider all around Australia. We have also received funding through public hospitals, departments of health, as well as through private health funds. So please reach out to us if you need help. We are also providing level 2 and level 3 NDA support coordination. Or if you need help with the NDAs in general, I would only encourage you to reach out to us as well. And we are also providing an ED, emergency department bypass service for the Western Sydney local area health district. So we're keeping patients out of ED as well by sending our critical care nurses into the home. And if you are a critical care nurse and you're looking for a career change, we want to hear from you. And if you have worked in ICU for a minimum of 2 years, or in pediatric ICU or in ED for a minimum of 2 years, and you have ideally completed a postgraduate critical care qualification, we want to hear from you. We currently have jobs in Sydney, Melbourne, Brisbane, Albury, Wodonga, on the New South Wales Victorian border, in Bendigo, in Country Victoria, as well as in Warragul, in Country Victoria. We want to hear from you. And please note, if you are a critical care nurse and you want to work for us, we are not an agency. We are a service provider that has a tailor-made solution or has tailor-made solutions for our clients. And that includes regular shifts with regular clients, because our clients want the same staff over and over again. They don't want people coming and going. So only apply for us if you want to commit and if you want to work with our clients regularly and if you want to make a difference to their lives. And if you are an intensive care specialist, we are currently also expanding our medical team. We want to hear from you. And if you're an intensive care specialist watching this or reading this, and you have bed blocks in your ICU, which I know you do, we can help you eliminate your bed blocks. We can help you taking your patients home safely, and you don't even end up paying for it. And if you're a hospital executive watching this, we also want to hear from you, because once again, we can help you eliminate your bed blocks in ICU and ED. We want to hear from you as well. And if you are an NDI support coordinator and you're looking for nursing care for your participants, or you're looking for a nursing assessment for your participant, or you're looking for nursing advocacy for your participants, please reach out to us as well. If you don't know how to get nursing care through the NDIS, I encourage you to reach out to us as well. And once again, you can contact us at intensivecareathome.com, either on the numbers on the top of our website for a phone call, or simply send us an email to info@intensivecareathome.com. Thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below if what you want to see next and what questions and insights you have from this video. Thanks for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.